G'day guys, my name's Alex. Welcome to the channel. Today we're talking about a lateral ankle sprain, rehab and treatment. So a lateral ankle sprain is the classic ankle sprain that most people get. You've changed directions or you've rolled your foot, something's happened and you've rolled and injured the outside ligaments of your ankle. In this video, we're going to go through mobility, strength, we're going to go through your proprioception and balance, and then your introduction into hopping and more dynamic and explosive exercises. This is the bulk of what most people, pretty much regardless of the sport, will have to go through before they can start getting back into training and getting back into their sport-specific rehab. So guys, by the time you finish watching this video, you'll have a really great understanding of how to attack your own rehab, but just remember this video is for educational purposes only. So guys, without any more messing around, let's get into that first exercise.
After an ankle sprain, we get a swollen and sore ankle and we lose range of motion. So it's really important that we get that range of motion back. Here I'm doing a knee to wall test. What this is testing your ankle's ability to get that knee over your toes. So find a piece of paper or a pen and mark on the ground how far back you can bring your heel whilst keeping it on the ground, and you can touch your knee to the wall. So I touch my knee to the wall, my heel stays on the ground, and then I mark how far back I can go. I then compare that to the other side. Ideally, you want to see between 10 to 12 centimeters of ankle range of motion. To help restore this range of motion, we can do banded ankle mobilizations. Now, realistically, you don't need the band, but it just helps give you that feedback in the ankle as to what you're doing. We're trying to get our knee over our toes. As much as you can when doing this exercise, try to get the knee over the big toe. Don't let your knee go out to the side, and as much as you can, try to keep that heel on the ground. Perform the movement for 2 sets of 10 to 20 repetitions. The amount of repetitions that you do is determined on how the ankle feels, pain and swelling wise, and just also on the irritability of the ankle. If it's really quite sore, keep the reps lower until you get your range of motion back. After an ankle sprain, it is important that we restore our ankle proprioception and balance. Simply starting off on single leg balance is a great place to start. For some people, this can be quite challenging. As you get better at this, you can add towels and mats underneath to make yourself get better at that static balancing. We can then turn into harder exercises like toe walking, where we're getting up as high as we can. This is a great strength and balance exercise. You're trying to keep that foot in a very neutral position so that you don't roll out to the side. Great little balance exercise and strength exercise. We can then go side on, working on those lateral structures of the ankle. These are all very low level early exercises just to get that ankle going early after a sprain. This clock exercise is a great way to get static, but also some dynamic balancing in there as well, because we have to control on the stance leg or the injured leg and then reach out with the uninjured leg. The further out you reach, the more demand that it puts on your ankle control and proprioception ability. You can also do this on the opposite leg as well. Work your way around the clock face, do about sort of 2 rounds, have a break, repeat. Great little exercise. Alright, now moving on to our strength exercises, it's always important to isolate the perineal muscles, which are the muscles on the outside of our lower leg. Our tib post and our perineal muscles are like the reins on a horse. It tells the foot where to go. So it's really important that we strengthen our anti-roll muscles, which are those perineal muscles on the outside of our leg. Pop a band around the foot, wrap it around the other leg as seen here, and work that eversion of the ankle, pushing in against the band. My favorite lower body strengthening exercise for the ankle is the bent knee calf raise or a soleus raise. Starting at a weight that you can manage, get on this machine, strengthen those calves. This will also help to strengthen your perineal and tib post muscles as well. For ankle health, it is important to have a very strong soleus muscle, so make sure that this is in your rehab diet. If your gym doesn't have this machine, you can always make a variation of your own, as seen here. Find a bench, find a plate to put your foot on, and then add some extra weights on top of your thigh. After an ankle sprain, we want to find our entry-level calf and ankle exercise. Most people can start off either at a double leg calf raise or a single leg calf raise. Make sure you keep your knee nice and straight and you're pushing up through your big toe, raising your heel off the ground. As soon as you can tolerate doing your single leg or double leg bodyweight calf raises, we can just simply add more weight to get a better stimulus. I like to work on some strength and endurance, meaning that I've got some higher rep ranges between 8 to 15 repetitions So once I can get up to 15 bodyweight exercises, I'm making it harder. So once you can do body weight on the ground, weight with body weight on the ground, you can then add a step just with body weight. This means more range of motion, it's harder, and then once your body can start to tolerate doing just single leg body weight, calf raises off a step, we can then begin to add weight to these exercises as well. Make sure that as we start to do these exercises, we focus on pushing down through the big toe. We try to get full range of motion. If you start hitching with the opposite hip, if you can't get all the way to the top, you need to lower the weight. By having an achievable weight, you're going to get that quality rehab in and strengthen up that gastroc muscle and that soleus muscle as well. For people that sprint and do heavy exercises, I like doing a double leg calf raise, but then you do single leg down, meaning that it's an eccentric only exercise. So up with 2, down with 1. This really maxes out your calf and gets as much endurance out of it as possible, because when we sprint, we have a lot more than our actual body weight going through our calf, and making sure that we can tolerate more than what our calf's able to produce is important when doing high speed sports. Once our strength is even between the legs, double leg pogos, single leg pogos are a great entry plyometric set of exercises to go into. Plyometric means we're just moving nice and quick. We're being nice and springy. Make sure that we're driving up, getting triple extension in the ankle, knee, and hip, and we're being as bouncy as possible. When we exercise and we sprint and we change direction, we're using our body quickly, so having exercises in our ankle rehab that move us quickly is really important as well. So range of motion, balance, strength, and plyometric or bounciness is really important to have in your ankle rehab. If you haven't touched on and worked on these qualities, it's important that you go back and get back into your rehab. It doesn't matter, it's never too late to go back to another step that you should have done and tick it off. So I really hope you've enjoyed that video today, guys. Please hit that like, maybe hit that subscribe button for me, and I'll see you in another video.